Hi you guys, welcome back to UWorld's Next Gen NCLEX review session. My name is Jackie and I'm a nurse here at UWorld. We're so glad to have you guys here today. We are wrapping up our maternal and newborn health week. We are going to be doing our question drill. If you guys had a chance to join us yesterday, you'll know the drill. But what you can expect for today is we're going to walk through 10 questions. These are all focused on newborn health. We're going to be kind of real calculated and focused on how we're reading them. I'll give you guys 30 seconds to answer, so use our chat, and then we will walk through why the correct answer is right. And if there's some that you guys get a little bit held up on, we can do a little more, dive into the information a little bit more. But again, this is all just to get you guys familiar with questions, especially as you're in crunch time for the NCLEX coming up in the summer if you've just graduated nursing school. So again, we hope this will be helpful for you guys. As always, let us know where you're coming from. Let us know too if you've taken your NCLEX, if you've passed, if you're waiting to find out. We love to hear all of those great success stories. So we have our content experts moderating the chat, so if you have any questions along the way, feel free to ask them. They'll make sure and address them for you. And to all our friends on TikTok, make sure you guys share this session. The more the merrier. We hope we can reach as many nursing students as possible. So again, we'll get started. We're doing 10 questions. This is for newborn health. We'll kick it off and I'll read the first one and we will go from there. All right, question 1. The nurse is caring for assigned clients. The nurse should first assess the option 1, a 1-day-old client who passed a dark, sticky stool. Option 2, 2-day-old client who has 6 to 8 wet diapers each day. Option 3, 3-day-old client who has a high-pitched shrill cry. Option 4, 4-day-old client who sleeps 14 hours each day. That sounds lovely. All right, I'll give you all 30 seconds to answer. Let us know what your thoughts are on the correct answer, and we'll go from there. I'm seeing all of our things come in now. Our answers come in on Instagram and YouTube and Facebook. They're flying in now. Thanks for using the chat, guys. Hello, everyone on TikTok. Thanks to anyone who is sharing our session. Again, we have 10 questions, so lots of opportunities to join in. All right, yeah, use that chat. Good work, everybody. A lot of really good answers. You're doing awesome. Okay. All right, a few more seconds and then we'll pull up the answer. Good job, everybody. Great answers. I'm going to pull this a little bit closer here. Okay, all right. So our correct answer is option 3, a 3-day-old client who has a high-pitched shrill cry. So again, with these questions where you see those bold words like first is going to mean most important. So again, think ABCs, the most critical things that we need to assess as a nurse. And then also look for options that are expected versus options that indicate a complication. So in this client, a high-pitched shrill cry typically indicates neurological problems in a newborn. So this is like a hallmark sign of neonatal abstinence syndrome, and it's a sign of withdrawal. So that can be something we need to further assess. So you guys did really great on that one. So we'll move on to our next one. And let's see if there's any questions coming in. Yeah, everyone did really great. Okay, we'll move on to question number 2. Good work, you guys. All right. Question 2 says, the nurse is screening newborns for those at risk for developing hypoglycemia. The nurse should recognize that the client at highest risk for developing hypoglycemia is the newborn who, option 1, has a respiratory rate of 55 per minute. Option 2 has a temperature of 98.2 Fahrenheit, 36.8 Celsius. Option 3 was born at 38 weeks gestation. Option 4 had a birth weight of 4,365 grams or 9 pounds, 10 ounces. All right, so I will let the timer start. We'll have 30 seconds. Put your answers in the chat and we will go from there. Wow, you guys answered very fast. Good work. Good job. A lot of great answers coming in. Good job, everyone. A lot coming in on Facebook and YouTube. I'm going to wait for our Instagrammers to pop up and our TikTokers too. Good job, you guys. A lot of right answers. This is telling me that you guys likely joined on Tuesday when we talked about pre-gestational and gestational diabetes. So good work. And thanks to everyone on TikTok for sharing. We hope you guys do that. And as always, if you're new to us, make sure you're following and subscribing. We've got lots of great info for you. Okay, so with that, we'll pull up our answer. You guys are definitely getting it. All right, option 4 is our correct answer. Good work. So again, highest risk is going to mean the client with the most risk factors oftentimes. So again, we're looking for findings that are expected versus complications. So newborn hypoglycemia is a complication oftentimes of gestational diabetes, and it's going to occur after the baby is delivered. So this happens because the baby is used to getting glucose from the mom, and the amount that the baby can produce outside the setting of like the womb, it's usually not sufficient. So essentially their glucose levels are going to drop after they're delivered. So a major clinical feature of gestational diabetes, or like a risk factor for it, is macrosomia, or a birth weight greater than 4,000 grams or 8 pounds 13 ounces. So our client in option 4 has that, and so that would indicate that they are at the highest risk. So again, our option choices for 1 through 3, those are all expected findings. Those are all within what we would expect to see. So again, thinking about expected versus complications. All right, good work. Let's move on to question 3. You guys are doing awesome. And keep track of how you're doing too. At the end, we want to know how many you got right out of 10. Okay, question 3. The nurse is caring for a newborn who has jaundice and is receiving phototherapy. Which of the following actions should the nurse take? Option 1, keep the newborn fully clothed. Option 2, apply lotion to the newborn's skin. Option 3, place an eye mask on the newborn. Option 4, instruct the newborn's parent to avoid breastfeeding. All right, our timer is going. We have 30 seconds. Put your answers in the chat. Good work, you guys. A ton of right answers coming in. I'm already seeing our Instagrammers come through. Good work. Good job on YouTube. Good work on TikTok too. Wow. They're flying. Good job, you guys. Keep engaging with us. Ask any questions too. Good work, you guys. Okay, just a few more seconds. Good job. Very, very good. Very good. All right. Good job. Here comes TikTok too. Good job. Ooh. On fire. Yes, we are. Okay. All right. We'll pull up the right answer. The correct answer is option 3. So again, when the question's asking us, which of the following actions should the nurse take, we're looking to what is expected, like what's an appropriate action, what's going to be safe for the client. So think about that when you see those questions too. All right, so our correct option again, place an eye mask on the newborn. So hyperbilirubinemia, it occurs when excessive, hyperbilirubinemia occurs when we have excessive bilirubin circulating in the newborn's blood. So this can cross through the blood-brain barrier and cause some like neurological dysfunction and brain injury. So treatment for this is going to be phototherapy, or having the baby be under those UV lights. So again, these are specialized fluorescent lights, and they facilitate that conversion of bilirubin to be able to be excreted through urine and stool. So during phototherapy, we want to protect the baby's eyes. So putting an eye mask on is appropriate. But you guys did awesome on that. So good work. I think you guys know what to do when we're treating jaundice. So we will move on to our next question. All right. Question 4. Oh, and thank you to anyone who's sharing us. We still have tons of questions to go through, so invite all your friends to join. Okay, question 4. The nurse is preparing to administer a vitamin K injection to the newborn. Which of the following injection sites would be appropriate for the nurse to use? Option 1, umbilical region of the abdomen. Option 2, anterior upper arm. Option 3, anterior lateral thigh. Option 4, posterior buttocks. All right. Good job, you guys. A lot of right answers coming in. I checked our time. You guys have about 20 seconds left. Good job, good work. All right, good work on Instagram. Let's see our TikTokers come through. Make sure you guys use that chat. We love to see it. Good job, you guys. A lot on YouTube. Good work. Wonderful job. Okay, awesome. All right, just a few more seconds. Good work, good work. This is great to see you guys really have these concepts down, so well done. Okay, our correct answer is option 3, anterior lateral thigh. And essentially, when we see in that stem what would be appropriate, that means it's going to be safe for the client. So in a newborn, when we're giving that vitamin K injection, that is the site we give it in. So again, just a little back info on vitamin K. Vitamin K is an essential component for the synthesis of coagulation factors, but in newborns, they're born with a deficiency of vitamin K. And a lot of this is due to poor placental transfer. They don't have that gut flora that's going to synthesize that vitamin K for our body to use. And their livers are immature. They're not doing what a mature liver would. So vitamin K deficiency can cause that spontaneous bleeding from various sources like circumcision site or umbilical cord stump. So again, we give that IM injection of vitamin K prophylactically to help reduce the threat of hemorrhage. And again, that's the biggest muscle the baby has to accommodate that type of IM injection. So that's the place we give it. All right, well done. Good job, guys. Okay. We are at question 5, our halfway mark, so I will read it and we'll go from there. Okay, the nurse has attended a staff education program about circumcision using a plastic ring device. Which of the following statements by the nurse would require follow-up? Option 1, petroleum jelly should be applied to the gland's penis with every diaper change. Option 2, yellow exudate at the site is expected for 2 to 3 days after the procedure. Option 3, the penis should be washed with warm water after each void and bowel movement. Option 4, the parent should notify the healthcare provider if the plastic ring is still in place after 7 days. All right, that one's a little bit longer, so we will give you guys a little bit extra time, but I'm seeing a lot of good answers come in, so this one I'm seeing a lot of mixed answers come in too, so we can spend just a little bit more time on it. So good job, you guys. You're doing awesome. Let us know what you think. I'm seeing Instagram and YouTube. Good job, everybody. Good work on YouTube. And Facebook I'm seeing. Looking for our TikTokers. Make sure you guys use that chat. We love to see it. Good job, everybody. Awesome. All right. Okay. I will pull up the right answer. So our correct answer is option 1. So again, require follow-up. That's going to mean we're looking for incorrect statements or interventions or actions, teaching, understanding that will not keep the client safe. So our correct option here, again, is option 1. So circumcision is the procedure that removes the foreskin from the gland's penis using a clamp method or the plastic ring method, which is what we're talking about here in our question. So when performing circumcision with a plastic ring device, petroleum jelly is not indicated because it can cause that ring to dislodge before the skin has healed. So that statement by the nurse would require follow-up. We don't want to be applying petroleum jelly. That would be used for the alternate method using a clamp. So I did see a lot of different answers, so we can walk through some of these too. Okay, so option 2, that exudate, that's expected for 2 to 3 days. If you see that beyond that, we would want to contact the healthcare provider and worry maybe about some infection. And then option 3, washing with warm water, this is indicated. This is going to help prevent any infection to that exposed site. And then option 4, notify the healthcare provider if the ring is still in place after 7 days. It should fall off or become dislodged at between 5 and 7 days. So if it's still in place at 7 days, we're going to want to contact our healthcare provider. We might worry about a little complication, maybe some adhesions. So good job on all of that one. You guys did great. Okay, moving on, question 6. We're on our downhill slope now. But again, you guys are doing awesome. Make sure you share this. We still have lots of questions to go through. Okay, the nurse is caring for a newborn who was born 1 hour ago via cesarean birth. Late decelerations with absent variability were noted during labor, and the umbilical arterial blood pH is 6.9. Which of the following actions would be a priority for the nurse to take? Option 1, prepare the newborn for therapeutic hypothermia. Option 2, prepare to administer IV 5% dextrose in water. Option 3, prepare to administer anti-seizure medication. Option 4, prepare the newborn for metabolic screening. All right, so I'll give you all 30 seconds. Let us know. I'm seeing a lot of good answers coming in on YouTube. All right, good job, you guys. A lot of good answers. I'm seeing YouTube. Maybe this one's stumping you guys. They're not flying as quickly, so we can also spend a little bit more time walking through this one. But good job. Good. Here comes Instagram and YouTube. Good work on Facebook. A lot of right answers coming in. Good job, you guys. All right. I'll give you all a little bit more time since the answers are starting to come through. Good work. Good work. Also, let us know how you're doing at that halfway mark. Are you 5 for 5? 4, 3 for 5? All right, good work. Okay, let's pull up the answer. So our correct option is option 1, prepare the newborn for therapeutic hypothermia. So again, when we see priority, it's going to mean most important. So A, B, C. So always think about this. This kind of relates to that C, that circulation. We're thinking about what's anticipated versus not anticipated for this client, or what really makes sense for this client. So this one, we'll walk through a little bit more of this like patho behind it. It's a little lengthier, but I think this will be a really unique learning opportunity too. So late decels on fetal monitoring and acidic arterial blood pH, these are signs of like inadequate fetal oxygenation, and they're indicative of perinatal asphyxia. So perinatal asphyxia can lead to a range of like poor neurological cognitive outcomes in the newborn. So this can include like learning disabilities, hypoxic ischemic encephalopathy, cerebral palsy. So a newborn assessment, so when we do the newborn assessment, what we're going to see on that assessment is going to be a low APGAR score. We talked about that on Tuesday. Neonatal seizures and acidemia, which is what we're seeing with that blood pH. That 6.9 indicates that our blood is acidic. So what therapeutic hypothermia does, it's an appropriate intervention for this situation. So it involves lowering the client's body temperature through either cooling blankets or a little cap. And what it does, it's going to limit the damage of that hypoxic ischemic encephalopathy. So essentially the cold therapy, it limits the swelling in the brain, just how we apply ice to inflammation. It's doing that same thing for that brain inflammation. It's going to reduce complications associated with the brain inflammation in the newborn. So a pretty cool learning about, the science that's helping newborns, but all of our other options, we'll walk through those because I did see a few different answers, but option 2, this is treatment for hypoglycemia. Option 3, this is something we would do, but it's not the priority. We want to address that inflammation first. And then option 4, this is part of all general newborn screening. So it's screening for a variety of different conditions, but again, not a priority, but something we will do. All right. Okay. Good job. Let's see. Everyone's doing good. I'm seeing 5 out of 6. Very, very good job. You guys did great. Awesome. Okay. All right. Question 7 out of 10. The nurse is observing a staff member caring for a 10-month-old client who had a surgical repair of a cleft palate 1 day ago. The nurse should intervene if the staff member is observed. Option 1, giving milk to the client. Option 2, offering a pacifier to the client. Option 3, applying mittens to the client's hands. Option 4, administering oral analgesics to the client. All right. Good work, you guys. Let's see what we think. Good job, good job. Let our time go. Awesome, awesome. Good job. I'm seeing a bunch come in right now. Good work on Instagram and YouTube. Good work. I'm seeing TikTok come through. Again, they're going so fast I can't read anyone's name, but you guys are doing awesome. Okay. Wow, a lot of answers coming in quickly on this one. Thanks for answering so quickly and engaging in the chat. All right, so our correct answer is option 2. So again, intervene is going to mean the option that's not safe. And then again, we're looking for options that are indicated versus contraindicated. So cleft lip and palate are common congenital defects caused by like an incomplete fusion of the palatine bones and the maxilla during fetal development. So cleft palate is going to be a malformation of the roof of the mouth. So surgical repair typically happens like after 6 months of age, but pacifiers should be avoided because that suction can disrupt that surgical suture on in the palate and cause bleeding. So that is definitely what we don't want to be doing. Again, we don't want to increase their risk for hemorrhage. So that is our correct answer. So good job, you guys. Awesome. Okay. Question 8, we are moving right along. Okay, the nurse is caring for a 12-hour-old client who has tremors and an inconsolable high-pitched cry. The client's parent reports taking lorazepam and hydrocodone throughout the pregnancy. Which of the following actions should the nurse take? Option 1, swaddle and gently rock the newborn. Option 2, increase the newborn's environmental stimuli. Option 3, remove the pacifier from the newborn's mouth. Option 4, place the newborn in the prone position after feedings. All right, thanks to everyone on TikTok for sharing us. Awesome, awesome, awesome. Good job, you guys. Let's see what y'all think. Thanks for following us on TikTok. Good job, you guys. Way to go. I'm seeing a lot come in on Instagram now. Good job on YouTube. A ton of right answers. Good job on Facebook. You guys are doing great. Good work, good work. Awesome. I did not look at the time, but I feel like we're 10 seconds away. I'm seeing a ton of right answers come in, so I'll give you all a little bit longer, but y'all are doing great. Awesome. We have 2 questions left after this one. Good job. All right. Okay. Let's see. So our correct answer is option 1. So again, following action should the nurse take? This is going to mean we're looking for what's anticipated for our scenario versus not anticipated, or appropriate versus not appropriate. So in this kind of scenario, what we're seeing here is neonatal abstinence syndrome, and this can be life-threatening to the newborn. And again, this happens when the fetal client is exposed to opioids, benzodiazepines, and nicotine in utero. So neonatal abstinence syndrome is typically going to manifest hours to days after birth, and it's when the newborn's blood level of these substances starts decreasing. So what it's going to look like in these newborn clients is going to be yawning, high-pitched crying, neuromuscular irritability like tremors and like hypertonia. Nursing interventions for this, it's going to include swaddling the newborn. And you want to swaddle them in a flex, like cozy position, because that's what their instinct is going to be for self-soothing. And again, this is going to help them like reduce their ability to self-stimulate, so they're already going to be in that cozy position. So we want to swaddle them and rock them gently. Our other options here, we're all about decreasing that stimuli. They're irritable. We don't want to aggravate their CNS system and increase any risk for seizures. So our correct option is option 1, but you guys did really great on that one, so well done. And then I think, yeah, everyone did great on that. Okay. Again, I'll just say this. So stimuli, again, we want to decrease our chances of seizures. Option 3, we don't, pacifier is a form of self-soothing. So we want to encourage that. We want them to be able to soothe themselves, have that ability to suck on a pacifier. And then putting them in a prone position. A lot of times newborns are, prone means on our belly. So we don't want to put them in this position. They have chances of reflux, so we want to keep them upright. All right, question 9. The nurse is assessing a full-term newborn. Which of the following findings would be a priority to follow up? Option 1, irritability and jitteriness. Option 2, passage of dark, thick stool 12 hours after delivery. Option 3, respiratory rate of 36 per minute. Option 4, blue-gray discoloration of the skin around the sacrum. All right. Let's see what y'all think. I looked at the time. Give y'all a little bit longer. You guys are doing great. Let's see what you think. Good work, good work. All right, a ton of right answers coming in. Good job on YouTube and Facebook and Instagram. Good job, you guys. Good work on TikTok. Wow, a lot of great answers. Y'all are doing awesome. All right. Okay, 5 more seconds. Thanks to everyone on TikTok who shared us. To everyone, make sure you follow us. All right, let's pull up our answer. Okay, correct answer is option 1. Again, priority, that's going to mean our most important. So what do we need to look at first? And then we're looking for options that are, again, expected versus what might indicate complications. So again, in this one, we're addressing that newborn hypoglycemia. So this happens again when the newborn's blood sugar decreases after the time of birth. They're dependent on the mom for those glucose levels, but when they're out of the maternal environment, they're dependent on their own body to produce that glucose, and they can't keep up to what they were used to in the womb. So again, that's going to look like manifestations of this. It's going to look like cold stress, our irritability and jitteriness, kind of what we would think of in an adult client with hypoglycemia. So that is our correct option. We're going to follow up on that. We might need to check their blood sugar and administer some medication to help bring that level up. All right, but you guys did really great on that one, so I think you got it. All those other findings, those are totally normal, expected, uncomplicated findings in a newborn. All right, last question. Question 10. The nurse has taught the parent of a newborn how to suction nasal secretions. Which of the following statements by the parent would indicate a correct understanding of the teaching? Option 1, I will compress the bulb syringe after I insert it into my baby's nostril. Option 2, I will suction my baby's nasal secretions only after feedings. Option 3, I may suction both my baby's nostrils if necessary. Option 4, I should clean the bulb syringe weekly. All right, let's see. Last question. Make sure you're keeping track of how you're doing. And as always, let us know how you guys like these question drills. Let us know, too, before we're done. We love to hear. And let us know, too, some major topics that you're interested in that we can incorporate for you guys as you're preparing for your NCLEX. You guys are doing awesome. All right. Good work, you guys. See what y'all think. Again, we're looking for correct understanding. I'll give you all about 10 more seconds, and then we'll walk through our last question. Good job, good job. Awesome. All right, I'll pull up our right answer. So our correct answer is option 3. So again, correct understanding means we're looking for statements that are going to keep the client safe. They're going to be appropriate and indicated. So that is our option answer in option 3. So again, you might have to suction both nostrils. Again, the purpose of suction in a newborn and in those infant clients is to clear secretions that they're not developmentally able to clear themselves. So that's the purpose of suction. For option 1, you don't ever want to compress the bulb suction in a client's nose. That's going to push all that air in there, and we don't want to do that. Option 2, you want to suction before feedings. It's going to open the airway, allow them to breathe better when they're latched on to whatever their form of nutrition is. And then option 4, clean the bulb weekly. We want to clean it after every time. You don't want to let a week's worth of secretions kind of boil up there in that bulb section. So option 3 is our correct understanding of the teaching. So you guys did awesome. I'm seeing a lot of great scores on here. Good work, everybody. All right, that brings us to the end of our newborn health question set today. We hope you guys liked it. As always, these live sessions are available on demand on Facebook and YouTube. We hope you'll check them out. We have a lot of great resources for you guys, but we know as you're in crunch time for your NCLEX this summer, make sure and check out nursing.uworld.com. We have a free 7-day trial. It'll give you a great taste of all of these, what UWorld's all about, our great content, our questions, our explanations, our images, our note card features. We have amazing lecture videos as well, and a study guide planner too. So make sure you guys check it out. Also, just check out the great resources on our website. We're here to help you. We want you to be successful. We want you to be amazing, safe nurses when you get into practice. So y'all have a great long weekend. We'll see you next week. Make sure you tune in on Tuesday at noon Central Time, and we will see y'all then. Thanks again. Bye.